Hello, hello, hello. Welcome so much. Welcome to everyone. Thank you so much for joining us as a Women Global Network for Reproductive Rights for this session on learning how for the Women Health Matters campaign workshop. We are just getting in other participants and we would request that you can just write in your name, which organization you've joined us with in the chat box. Also maybe as well as maybe your email address so that we can be able to talk to you and communicate afterwards and be able to also share about the campaign. But we're very happy to have you with us today, and we're also very happy that you took the opportunity to join us as we prepare and as we work to commemorate May 28th. My name is Mageda Esolio. I am with the Women Global Network for Reproductive Rights in the Nairobi office, and I will be your host for today. So just before we proceed, we'd just like you to share your names and also the organization you're joining us with in the chat box. And we also try and follow in terms of security and ensuring our participants feel safe in the group and in the room. So we hope that everyone who's in the group has been verified. And we really like working with our allies so that we ensure that everyone is safe at their countries and wherever they're joining us from. I know we have participants from the Philippines, from Bhutan. We have participants from Kenya, from Tanzania, and we hope that you'll use this opportunity to network and meet each other as young champions in your various countries, and also be able to use this opportunity to learn how the Women's Health Matters campaign and the workshop. Really, this is really a workshop, so it's really a sharing and a discussion space, and we hope that you can be able to share and learn from each other. I see people writing in the chat box. Feel free to use that platform, as I said, to share your names. So I'll just give it a minute so that we can get more people joining in and give more participants an opportunity to come in before I invite our team, a great team of colleagues I work with, to be able to help me and so that we can continue together. Yes, so welcome. I see a lot of comments in the chat box. Yeah, and I will definitely be able to take us through the program and the expectations. But just to say that as W General, we felt that it would be important to organize this workshop to ensure that young people are given some capacity and supported in terms of running the campaign. And this is to help youth organizations in Asia and Africa in their social media campaigning for May 28th, and to ensure that we also support mobilizing better support for women and girls' health. And some support will also be provided to selected youth organizations. But we are super happy and excited that you could take this opportunity to be with us. So yeah, I'm really trying to see if we're all in and if our waiting room is empty. I think we have a good number and a good quorum. And I think we can be able to take off. Hopefully we won't leave anyone behind. But at this opportunity, before we continue in further, we have an amazing executive director, and I would just like to introduce her to be able to give us just a snapshot and a brief about the May 28th campaign. I'm sure all of you have heard a lot about it, but this would be an induction in such a way that you can be able to also explain it to other young people. Welcome, Ms. Ping.
Hello, everyone. Good evening from Manila. Good morning, good afternoon, wherever you are in the world. Thank you for joining. So I am Bing Parcon or Marivic Parcon from the Women's Global Network for Reproductive Rights. And yes, I'll be talking to you about the context of May 28th. I'm pretty sure that every one of you, of course, you are here in this session and you've heard about this campaign, but you want to learn more how it emanated, where did it originate. So May 28th has been a very, it has been going on for years. I mean, even before you and everyone have been, born. So we have been commemorating this campaign since 1987 during the International Women's Health Meeting in Costa Rica, where the Latin American and the Caribbean Women's Health Network proposed to celebrate annually May 28th as the International Day of Action for Women's Health. It is being collaborated between the Latin American colleagues and the Women's Global Network, who has been a big organization with 1,000 members in the past and until now. So we spearheaded the campaign globally, and both networks in Latin America and also WGNR in its global membership have been working closely together with group of core members in coordinating the campaign efforts. So from the very start, this campaign has been a collaborative effort, a joint action by grassroots communities and activists from the Global South. So the first call to action, if you notice, we also sent you the call for action for this year. Normally we send the call for action for each year, but in the very beginning, the call for action was a multi-year campaign on preventing maternal mortality and morbidity, and was an immediate success and achieved results on several levels. The first being it provided women's grassroots organizations with greater access to information that was previously only available through specialized journals. Before, there was nothing of this kind, because before there's no online discussion where immediately you are able to have this conversation, to have clarity on whatever is going on. Before, you have to send the call for action through snail mail. So it was that start where grassroots communities have been able to receive information with regards to women's health and maternal mortality and morbidity. And the campaign brought to life significant gaps in research data on women's health, which resulted in more face-to-face meetings, seminars, and research studies. So the campaign sparked that interest to women's health, that it actually, at the national level, people and women's human rights organizations have started doing research with regards to women's health and reproductive rights. The participation in the internationally coordinated campaign brought the women's health movement closer together at both national and international levels, which means that it became a movement since 1987. It became a movement that it has that strong solidarity between the national organization and international organizations, strengthening a movement for reproductive rights and women's health rights. That impacted in the 1990s the international bodies like World Health Organization, the Pan American Health Organization, and the World Bank took up the issue under the theme Safe Motherhood, encouraging investments of funds to improve services and in sponsoring seminars, trainings, and research programs along this line. So this has been our victory for the last, decades of working for women's health and saying that women's health matters. So since 1987, May 28 has been recognized as an International Day of Action for Women's Health by several governments. That includes the government of South Africa, where every May 28 it has been officialized as the Day of Action for Women's Health. And various international agencies, like I said earlier, World Health Organization, the Pan American Health Organization, and the like, and multiple civil society organizations all over the world. We have sustained the feminist campaign for over how many decades now, since 1987, with the range of topics for each year. So we campaigned for access to quality healthcare, the feminization of poverty. So which means that even the issues of poverty, which is a social issue, it also is a women's health issue. So it became a big call to action in the past. We also talked about safe and legal abortion, and that is actually until now. We also talk about and campaign for government accountability and prioritizing health markets. We also talk about health sector reform, HIV and AIDS, international trade agreements, and women's access to health, violence against women as a health, global health emergency, young people's SRHR, and this actually, concerns you, access to contraceptives, and many others that we actually were campaigning for in the last 3 decades. So May 28th is also a day wherein organizations and individuals mobilize their communities around their own priority topic. So I said that there is that call to action that we do every year, but the organizations also contextualize, translating it in their own context. Whatever is resonating in their own context, that's where they are mobilizing around May 28th. So over the years, WGNR has served, as a center for the mobilization around May 28th. We equipped our partners and members with campaign materials, and this is what we're doing right now. And we have that, a conversation to clarify what do we mean by this call to action and how to mobilize around the call to action. And we also say that any other, organizations working on women's health rights or women's rights for that matter can do their own activity during May 28th, and we encourage everyone to do, even if you don't want to adapt the call for action, you have your own call to action. That's okay, as long as it resonates to your own context. And so for this year, I'm sure you already received the call to action. We are calling for the call for action is now focused on the impact of the COVID-19 to women's health and overall well-being, particularly for us, for us people that are living in the global south. And I'm sure nobody is in the room right now who's actually living in the global north, or more progressive countries. We say, and we always say this, and I'm sure you as advocates as well, we say that COVID-19 have impacted us all, but we also recognize that it did not impact us equally. And what it does, it only exposed and exacerbated the long-standing social and gender inequality. So later, Mageda, Matilda, and Danica will explain more, expound on what the call for action is about. And this call for action for this year talks about the intersecting levels. It talks about women's rights to health, bodily autonomy, equality, non-discrimination, and freedom from violence. And this is where the mobilization is actually, coming from and focused on for this year, and also in the coming Friday, this coming Friday, May 28th. And May 28th can also be, until June, until when it is actually still relevant, and it is women's health matters anytime, anywhere, any day, any year, all the time. So I think that is, that captures the call for this year. And this call has been a result of the consultation with various organizations globally, and we work collaboratively with partners to mobilize around May 28th this year. We are working with the Center for Reproductive Rights, ARO, in Asia, and we are also working with Asia Pacific Alliance for SRHR, International Planned Parenthood in East and Southeast Asia and Oceania region. We're working locally in the Philippines with the Philippine Safe Abortion Advocacy Network, with research as well, a group of feminists under 40 working on sexual and reproductive health and rights. Also with the Safe Abortion Advocacy Initiative Global South Engagement, or SAGE, a network of safe abortion activists in Asia, Latin America, and Africa. And with the International Campaign for Women's Right to Safe Abortion, She Acts Africa, where most of our colleagues from Africa are part of, and also, of course, WGNR Africa. So I'm excited to have this conversation with you, and for more clarification later about this campaign, our colleagues will walk you through. And also, the campaign website is may28.org. If you have time, and I'm sure you will have, please download the materials, which are all available on the website. And yes, my colleague Shifra Wilongel will be talking about the call for action in a little while. Thank you, and have a good meeting this afternoon.
Thanks so much for that, Ping. Thank you so much for that introduction. Really taking us into the call to action and the May 28th campaign. So at this opportunity, I'd just like to take to acknowledge and also thank various attendees and various organizations that have joined us. So we have DRUK, I hope I'm saying it correctly, DRUK, Youth Initiative of Sexual Advocacy from Bhutan. Thank you so much for joining us. We have Her Voices Alliances. We have Kuza Livelihood Improvement Project. We have the Youth Advisory Council from Kenya. We have the Youth Changers from Kenya as well. So those are organizations that have joined us from Kenya. We have the youth-led SRHR advocacy Nepal, Yoshan, joining us as well from Nepal. Thank you for joining us. We also have Youth Advocates for SRHR joining us from the Philippines. Thank you so much for joining us today. We have the Youth Advocacy Network from Sri Lanka. Thank you so much for joining us. We also have the Action for Change organization from Tanzania. Thank you for joining us. We have Reaching the Unreached Tanzania, RAT, or is it ROOT, from Tanzania as well joining us. And then we have Wadada Solutions on SGBV joining us as well from Tanzania. So thank you so much for taking time with your organizations to join us today. And just on the program, we hope to have this session at least for the next 1 hour, 30 minutes. And we will have Shiv, who will come in and share with us on the call for action and discuss and just explain to us about the call for action for anyone or for all of us who haven't interacted with it. And then we will have Danica Shahana Maktumbo, who will also our SRHR Youth Advocate Officer, and Matilda as well from the Africa Office, who's our WGNR Africa Youth Officer, who will take us through really learning how and the Women's Health Matters campaign, and how you can be able to campaign and adapt the campaign to your context. So without further ado, I welcome Shiv to take us through the call to action. If you have any questions, kindly put them in the chat box. We will definitely have a discussing segment or session. I would also just have, because we're trying to have it to be very interactive, we would give an opportunity for you to be able to ask your questions to our panelists, to also those who will be giving us information. If you haven't been able to share your organization's name, kindly do so in the chat box so that we can be able to follow up with you in terms of the campaign and the next steps. Welcome, Shiv.
Hello, Mageda. Thank you. I hope everyone can hear and see me clearly. Yes? All right. So what I'm going to do today for you is I'm going to first take you to our website, just so when you actually start campaigning, it'll be a familiar interface for you. Can someone enable my screen sharing, please? All right. So now you should be seeing our May 28 website. Um, so here you'll find actually all of our campaign materials that is being mentioned earlier, that we have every year, and of course free to use by our partners and allies and anyone who wants to use these materials. I'll just show you here. So under the campaign materials menu option under the resources tab, we have all the campaign materials from for this year and from previous years actually until 2016, I think. Yes, so it's a lot. But hopefully, you'll find this year this campaign materials easier to navigate because we also put a new menu option which goes directly to the 2021 campaign toolkit. But before I go to the toolkit, actually, I'll just discuss that a little. But mostly what we're going to discuss today is the call for action, which is basically the reason why we're having this campaign, right? So you just click on that and then it'll show you the call for action. But today I will present to you an abbreviated call for action. You won't find this on the website, but it'll make it easier for me to just go through the points of our call for action. So if you read the original call for action that we sent out, it's like a long kind of article on our theme this year. So again, I'll present an abbreviated version because for the interest of time. So this is our call for actions. Okay. So the main theme this year is actually not much different from last year. We still use the hashtag Women's Health Matters. Actually, that's still a big part of the theme. The theme, if we put it on like as a phrase, it would be Women's Health Matters, ending the inequality pandemic, and ensuring SRHR remains essential. So our hashtags this year are hashtag Women's Health Matters, hashtag End Inequality Pandemic, and hashtag SRHR is essential. So why did we decide on those on that theme and those hashtags, or those they actually even serve as sub themes, right? It's because we had those consultations back in April, I think exactly a month before May 28th. We had consultations with various organizations at the global, regional, and the local level, and we discussed what were the most pressing issues this year in relation to women's health. And we found that the experience this year is not actually that much different from last year, but maybe even worse because we're already going through it for a year. Last year, that the theme was ensuring SRHR, women's health still matters, ensuring SRHR and remains essential and critical in pandemic response. So there's still that in this year's call for action. But what we realize is because of the prolonged and the protracted nature already of this pandemic, it's really begun to hurt marginalized sectors as months of the pandemic went along. So, and we see that inequality is a big issue, and that it's important to tackle, especially now. And that's why one of the themes, one of the hashtags is End Inequality Pandemic, because we saw how long existing inequalities are exacerbated by this pandemic and have dragged on, right? So now we see how northern countries are already going through mass vaccinations. They're already looking towards recovery, but us in the global south, we're still dealing with new surges, new strains, new variants of COVID-19. We saw how our countries especially have been vulnerable to the effects of COVID, and Um, that can be attributed actually to low spending on public healthcare or healthcare privatization, inadequate social safety nets, not enough aid, right, for a lot of us, and weak labor rights. So a lot of our labor force are actually in precarious situations. Also, our governments, because they're unable to respond appropriately to the pandemic, the easy thing to do is to resort to social control measures, and we saw them do that. We saw lockdowns, curfews, and increased police presence in our communities, and these things act acutely against working class and marginalized populations. So people that are most harmed are those that belong to lower social class, uh, who belong to minority races, who belong to women, and LGBTQI are also harassed in their communities by increased police presence. So we see that happening in the pandemic. We also see how, for example, in terms of who gets to go around, who gets to go outside their country, it's usually determined by social class too, right? It's rich people. We've seen how they've been able to just go around, even though we have a pandemic and we're still, we're stuck at home. This also affects most blue collar workers, migrant workers, and workers in the informal sector, workers who have no job stability, right? Because they have almost no options to work from home. If they don't go to work, it's no pay, no work, no pay. And so they usually, what they do is they just risk in getting infected with COVID-19. And during lockdown situations, they have no choice but to stay at home and not earn a living. So that's one of the key messages that's part of our call for action, that long existing inequalities are exacerbated. Hence, our call is to end inequality pandemic. And of course, we can talk about this. We can talk about inequality without talking about how this has adversely affected women's health and its impacts on women's health, especially since it's May 28th, International Day of Action for Women's Health. So we have to talk about how delivery of essential health services were disrupted, and sexual and reproductive health and rights in particular is deprioritized. So a year into the pandemic, actually, WHO came out with a survey with research study results saying that actually 90%, so more than majority of countries are still experiencing disruptions in their healthcare system. So that means they have not been able to cope yet, even though it's been a year into the pandemic. Our healthcare systems are still not coping, are still getting overwhelmed by the pandemic. And as a result, many services get disrupted as well. In particular, we have family planning, contraception, so SRH, and HIV services, as well as mental health services. Those were identified to be extensively affected. But we can't just say that these services were affected because we can't just say it's because of like a logistical issue. It's just because our healthcare systems are overwhelmed that these things happen, like that it wasn't intentional. What we can actually say is it's not there was already a deprioritization of SRHR, and that's why these things happen. We see that because we know how governments, for example, who have much more restrictive abortion laws or SRHR laws, they are less likely to actually do anything about disrupted SRHR services. So there is that, even though it's not direct or explicit, there is that deprioritization that is happening, and there is something behind that, right? There is like a policy decision behind that. And then, so that's why our call for that is SRHR is essential to make sure that governments, our decision makers, still know that SRHR should be prioritized or should remain a priority amid pandemic response. And of course, overall, women and girls' health and autonomy are heightened and at risk. Aside from physical health impacts, women and girls are unable to access SRHR information and services because of, for example, barriers to mobility. They can't go out of the house, they can't buy their commodities, they can't go to the clinics. We also have health impacts to women's mental health, and that's because they're working more in the home, so that's their actually the main source of stress that they identified as, in addition to worries about livelihood, food, and healthcare. And also, yeah, so there's mental health, and also there's gender-based violence. Of course, we know that when we're locked in our houses, we could be locked in with our abusers, and this disproportionately affects women, young people, and LGBTQIA. So but aside from this, because of the economic insecurity everyone is feeling, job insecurities, etc. Those kinds of tensions, those kinds of economic tensions also provide pretexts for gender-based violence to happen. So even if, for example, you weren't at the end of gender-based violence before, there are risks introduced by the specific pandemic situation that make you vulnerable to GBV. So there. So, and it's important to highlight that that's also a violation, right, of our rights to our bodies. Aside from SRHR. So as such, this May 28th, International Day of Action for Women's Health, we are speaking to end inequality pandemic and express outrage against the systematic neglect and denial of SRHR services to women and girls. Our aim this year is to highlight, promote, and support the many different ways activists and advocates are mobilizing to challenge inequalities and demand accountability. We will be steadfast in our feminist solidarity. We'll stay focused, energized, reflective, and motivated, for which taking care of ourselves and each other is essential. We will share our stories, make a stand, and take action. All right, so that's our call for action. Context. I'm going to skip that. All right. So if you go to the call for action document, you'll also find some suggested activities. So, for example, you can share stories and case studies in your local context, either country context or community context. You can help create videos. Those are always good because they're visual. You can help us keep the conversation going by posting and tweeting. Use hashtag Women's Health Matters and hashtag Inequality Pandemic, hashtag SRHR is essential, hashtag May 28. If you tag us at WGNRR, that will be easier for us to see your tweets, and then we can retweet, we can repost your post as well on Facebook. There. And then watch out for action alerts to know how you can support ongoing campaigns and send solidarity to other organizations. Actually, we've already been posting a couple of action alerts, I think since last week. And we'll continue to post this week so you know what activities are being done from all over. I think we've already registered, I think, more than 10 countries doing different activities where they are. Yeah. And then, of course, part of the call for action is also making sure that we are amplifying our voices and calling on governments and international organizations or key decision makers to respond to specific demands. So you'll find them also in our call for action. I won't go through them one by one, but I know you guys have a copy of the call for action, so hopefully you can go back and use it as a reference for whatever activities you might want to do. And here, yes, this is just more suggested campaign activities. Some of the things that we found were effective, we're organizing solidarity teach-ins. Usually that meant like if it's a solidarity teach-in, you would partner with someone else and then you would come up with a topic discussion that both of you could contribute in. If you co-organize with another organization, create safe spaces for discussions, occupy virtual spaces and platforms. Like I said, if you can tweet, post on Facebook and use your hashtags. We also have profile photos and tuebons you can use, so it'll show on your profile immediately. And then sometime, and it's also important for us to try to reach those who have no access to internet and mobile technology. What we're doing in WGNRR is we're going to make flyers, information materials, and the like, and we'll be distributing them in communities. I know other organizations are having community radios, so they can reach people who might not have access to internet but have radio in their homes. And also art contests, virtual galleries, online concerts. We're also having an online concert on May 28th. Hope you tune into that. And awareness raising, media forums, and public meetings and the like. Those are all very good activities. So our call for action was actually crafted, like I mentioned earlier, in consultation with several organizations. So these are our global partners, and also some of our partners at the local level. All right. Okay. So okay, sorry, I was too fast speaking. All right. If you have any questions, if I was too fast, sorry, I didn't get to see your messages while I was discussing because of the share screen. I can answer some of those questions already now, or maybe later after Danica, maybe after the discussion later. I'm not sure, Dan.
Hello?
Hello.
Maybe
Okay.
yeah. I think Mageda, if there are questions, maybe we can already um entertain them.
Okay. Okay, great. So just going to the chat box, I haven't seen any questions yet, but there is request to share the presentation as the presentation was a bit too fast. Apologies for that.
It's all right.
So yes, I think Shiv will follow up in terms of sharing the call to action, but I think we've also shared the link to the website. Also, we do understand that there could be a possibility of maybe not having a lot of funds to go to the website. So you can just try and also go to our Twitter handle at WGNRR. You would be able to find a lot of material and a lot of posting on what Shiv has talked about. And then I'm seeing Shiv has actually just shared the website, the campaign materials, and the call for action, and also our Twitter handle on the chat box. So if you can just try and access the chat box so that you can have access to this. And also some of the material on the website is downloadable, so you don't really have to stay online for long. You can just go on and be able to download it and use it in terms of your campaigning if you're doing online work. Also, the call for action can direct you in terms of going back and looking at what is happening at your country and just crafting it in such a way that you can be able to call out your government and anyone really a policymaker so that they can follow up, especially on how COVID-19 has affected young people. I think most of the people in this call are young people. So we really encourage you to do that and be able to put in your request and some of the concerns that you're going through at country level, at community level. And also we'll just try and follow up so that we can help. For those who are also engaging with the call for action the first time, it's just a document that has a set of requests maybe to the government, to policymakers on what can be done to ensure that, for example, in this case, women's health rights are followed up on and that they matter, and some of the issues that are coming out can be followed up in such a way. So without further ado, I will invite Danica Shahana, who's W Youth SRHR officer, and who's also been able to engage with the campaign. And she's from the Philippines, and she'll be sharing with us some ways in which our youth can be able to adopt the campaign, and especially young people, how it can be relevant to you guys and how it can be fun and exciting and what you can be able to do. We'll try and take it at a slower pace. And also, if you have any questions, feel free to put them in the chat box or just write them down. Wherever you are, we'll give an opportunity to have an open floor discussion with Danica. Uh, Welcome, Danica.
Hello, everyone. Good morning, good afternoon, good evening from the Philippines. It's 6:48 p.m. in the Philippines, and thank you so much for joining us in this learning house session. So basically, this first day is actually me and Matilda will be sharing about how we did the May 28 campaign with young people last year to hopefully uh, give you some ideas on what you can do as well in your community or in your organization, aside from what Chief mentioned earlier as activities that you can do. Uh, what we will be sharing as well is something that you can also get an idea from, uh, in terms of doing creative activities. And yeah, later Matilda will also be sharing. So I'll share my screen about um, I'm sorry, not this one. So I will only have a short presentation about the experience in campaigning in the Philippines. Um, because of course, globally we are experiencing the pandemic, but uh, as mentioned earlier, we are affected by it differently. Some are not recovering after a year in the pandemic. Some have already started because they are much more progressive country than we are. So and first I just want to share is that maybe a lot of us here can already relate that a lot of what a lot of us have made a lot of adjustment in the first quarter last year because of the pandemic, and that especially in our advocacy work for young people sexual and reproductive health and rights in the Philippines. That the context is that prior to the pandemic, young people's sexual and reproductive health and rights are not that um, prioritized in terms of policies or being responsive really to the needs of young people. Prior to the pandemic, there are already increasing adolescent pregnancies, especially among 10 to 14 years old. They are very young, and they have already become pregnant, and there are also increasing numbers of unsafe abortions that has resulted to maternal deaths. And these issues, these SRHR problems of young people have been exacerbated by the pandemic. And I think a lot of the global south countries can also relate that many SRHR issues have have been worse even up to now, even after a year in the pandemic. And a lot of us are still not, we cannot really say that we are recovering, um, we are recovering from this pandemic. And also in the Philippines, on top of this SRHR issues that has been exacerbated by the pandemic, uh, even before the pandemic, there's also the existing policies on SRHR that have not been really responsive to young people's needs in terms of providing access to young people's to contraceptives for young people, because uh, before 2020, the reproductive health law in the Philippines has been passed in 2012, but it is still restrictive to adolescents accessing contraceptives. Uh, and also, the reproductive health law that has a component on comprehensive sexuality education has also been delayed from 2012, and even up to now is not yet being implemented. Although they are planning to have a uh, pilot testing for the comprehensive sexuality education implementation, but still like uh, this has been too long, and then now they have to really think of ways during the pandemic how they can teach comprehensive sexuality education to young people on top of other problems, SRHR problems, and the pandemic. And also, our in the Philippines, the restrictive and highly stigmatized policy on abortion that penalizes women who access information and services. So I think a lot of you are also familiar that in Asia, abortion is in the Philippines, abortion is not allowed. Women or girls can be penalized. Even the healthcare workers can be performed. So a lot of women and girls resort to unsafe abortion practices. And why am I saying this? Because these are the contexts before the pandemic, and up to now we are still facing this year, after 1 year in the pandemic. Uh, and one thing that when I started the when we started planning for the May 28th youth campaign activities, of course, because this was during the pandemic, we really had no idea on how we can adjust to the demands of the pandemic. Because before, I think a lot of us here are used to doing our advocacy work face to face in the community with our partners, talking to them directly. But now, here we are still after a year, in the screen, uh, talking to talking to you, but not really seeing how you are reacting right now. So I think, personally, on my part, that has been a challenging, because I can't really know, are you like, if you have any like questions, or how am I right now, or even in the past year, like, we can't really know how a lot of young people are coping through this pandemic, unless we really see them, just like prior to the pandemic, that we've been doing community work. And uh, and when we started our campaign last year, we really need to understand what young people were facing. So that's why, um, so there was a few weeks, days, or I think I can say months, that we really, at WGNRR, we really didn't know what to do by that time, because we had a lot of various lockdown measures in the Philippines, that we really don't know what's the difference. Because yeah, the government has been the government has a lot of restrictions, as mentioned earlier by Ship. There were a lot of restrictions. This was a form of also control how the government has responded to the pandemic. Because and yeah, and that's been one of uh, the challenge to us in doing our campaign. But the truth is, we have to follow the restrictions because of the pandemic. We have to physically distance for now. We have to do a lot of our work online. And the first thing that we did is we had an assessment of the situation. So last year, around April last year, we had conducted a small scale survey for young people in the Philippines, asking them. This is just one part of the questions in the survey. So we asked them what are their specific information or services that young people need to access during home quarantine, because by that time in April we were still under quarantine. And the results just validated what we really need to work on, or to continue on working online. So we young people said that there were they needed age appropriate information on COVID-19, contact informations to report forms of violence, services on SRHR, and information. So this data helped us in our social media campaign, and that's why we were able to plan for our May 28th youth campaign activity, which is the Young People in Quarantine Challenge. We actually have a part two. I'll discuss that later. But yeah, this one, the Young People in Quarantine Challenge. So through the Young Advocates for SRHR, who are also present in this Zoom, in this session, we were able to have creative contests for young people to there were contests on short story writing, essay writing, poster making. So these are just examples of their outputs, and photography, opinion writing. So we have writing in visual arts contest where they are able to write or create arts about how they can support women and girls' health during the pandemic, and what are their calls and demands to the government. So some of the examples you can see here. This one is from the creative placard contest, where we ask them what their demands are to our government. So because during that time also, aside from the SRHR problems that we were facing, that young people are facing, there was a lot of human rights violation also, uh, and some young people, and even women's health activists, advocates were red tagged, or this when we say red tag, this is the tactic of the government to label someone as communist. So uh, really the government has taken this opportunity, the pandemic, to really control the critic in our country. So that's why during last year when we had our campaign, we aside from these creative contests, and we also had the learning sessions on sexual and reproductive health and rights. We also had a webinar talking about young people's sexual and reproductive health and rights with government agencies. And we also talked about youth activism during the pandemic, which of course very important because as mentioned, there were a lot of issues in terms of human rights violations and activism, and red tagging, I mean. So and yeah, so we also, this is just part of the May 28th report from last year. We can also share that to you to your email, so you can also check out some of the activities that youth activities that happened from last year. So yeah, this one is the report on the Young People in Quarantine Challenge. So when we had the contest, we had the learning sessions, We also had the health quiz bee. So what we provide to the what we give to young people who participate is we provide them with communication allowances. And aside from that, this year, those who won last year's challenge, we will be publishing as well their work in Young People in Quarantine publication that you must also check out later this month or early June. So we will share that also with you. And actually, one one important result of that Young People in Quarantine challenge, because the that was the key that was the a starting point for us to recruit more young people in our program through the Young Advocates for SRHR, because a lot of the young people who joined the Young People in Quarantine Challenge, the contests and the learning sessions, we also asked them to join the Young Advocates for SRHR to become members. And after that May 28th activities, we trained them for 3 weeks to through our 2020 Young People plus SRHR online boot camp, as around 15 young advocates from around the Philippines were trained in our online boot camp, and a lot of them came from the May 28th challenge. So that's what's really inspiring, because they did not just stop their participation during the contest or during the May 28th campaign, but they also continue in engaging with us through the Young Advocates for SRHR. And I think one advantage also of doing an online training, um, it, since Philippines is a very we have a lot of we have a lot of islands. We're not unlike unlike countries who are present here, like you, most of you are like in one, I don't know, I don't know the term, but yeah, in the Philippines, we really have to travel when we conduct trainings in Manila. Young people need to travel by plane um, uh, or by land just to go to a uh, training area before the pandemic. But since we were able to do the online boot camp, we were able to recruit young people even from the and a lot of them are from the southern part of the Philippines, where not a lot of YAS or Young Advocates for SRHR uh, have not a lot of previous YAS members are mostly from Metro Manila, but in the 2020 batch, we were able to recruit from various regions or various locations around the Philippines. So we're the group of young people from last year are very diverse, but of course, there are also challenges as well in doing this type of campaigns. Since we are really forced doing our advocacy work online since last year and up to now, and maybe in uh, a lot of years to come, we're still gonna be present online. So one of the challenges, of course, is the internet. Because in the Philippines, it's really slow. So we cannot guarantee that internet will be friendly to most of the sessions that we do. And of course, a lot of us are already experiencing online fatigue, and the relationship and interactions, you can't really get that kind of interactions compared to the face-to-face work that we do before. And then the location, since we can only do this online, we're really forced to just uh, meet online, and maybe in the future, in the next few years, we can, when the pandemic, when we're finally recovering, we can all meet like face to face. But really, with the situation in the Philippines right now, yeah, we're seeing that most of our activities in the next few years will really be online, and we need that uh, and the sustainability issue will be a problem, because there are really a lot of challenges doing online work. So yeah, so that's I think that's one of the these I'm sharing these challenges because after these workshops, after the 2-day workshops, we really need to look also beyond this May 28 activities that we're planning. We really need to look forward on how we can sustain our activities for the young people. So, uh, yeah, but for now, I think it's really nice to have a group of young people, youth organizations from Asia and Africa to have uh, plan, maybe later or tomorrow we can also like discuss how we can address the challenges, or how we can effectively uh, create a social media campaign that works for our community, that also can be sustainable in our in sustainable for the communities as well. So I think I'm gonna pass the mic to Matilda for her sharing.
Good evening, good morning, good afternoon to everyone in this room. I've been introduced, my name is Matilda Deus, and I work with Regional Africa, based in Tanzania, Dar es Salaam. So, as my colleague have been sharing, actually we have like common challenges that we are facing. We all know that the pandemic has affected us negatively, especially on the issues of SRHR for young people. We have been facing a challenge on resources, like resources allocated for SRHR to address SRHR needs for young people have been reallocated to curb the situation of COVID in different countries, especially in Africa, East Africa, and especially in Tanzania. And most of the young people's issues have not been put in priorities to be addressed. Like we have pending issues like there is comprehensive sexuality education curriculum. Most of the African countries have not started implementing, and some of them have not started the effort to start adapting the comprehensive sexuality education to different African countries, especially in Tanzania. There's no comprehensive sexuality education for to support adolescents and youth to access SRHR information and services. This leads to young people ending up in getting teen pregnancies. Hi, am I audible?
Yes, we can hear you. Continue, sorry.
Okay. As I was saying, like it is us to young people to encounter different challenges, like the increase of teen pregnancies, increase of gender-based violence, increase in unsafe abortion, since there's no, the access to SRHR information and contraception is limited in Tanzania specifically. and we were in the situation where, like, we as CSOs, NGOs, we cannot go to school to talk about contraception, to talk about sex, to talk about body autonomy, because it was all restricted. So young people are in this situation where they have no right information, they have no platforms to discuss their issues, their challenges. They have no access to contraception, because even the service providers have different attitude toward providing contraception to young people, especially adolescent and youth. So as WGNRR also, we work with local partners. We have been working around May 28th campaign to amplify the voice of young people, to ensure young people have improved the service around the SRHR and human rights as whole. So our campaign have been informed, as other speakers have previously mentioned, have been informed by local partners that we work with in Africa. We have active partner in Nigeria. We have active partners in DRC. We have partners in Kenya. We have partners here in Tanzania, South Africa, and other part of the African region. So WGN works to communicate with partners within Africa to get, to see their needs, where actually, what exactly they want to address in their local context. And from there, we drive up. Actually, our campaign, we drive our campaign 2 months prior the May 28th. So we have enough time to prepare and communicate with our partners to share the call for action, follow up, and do the needful preparations as we celebrate May 28th. So I'm gonna share my screen a bit, but most of the things have been addressed. Where can I share my screen? Okay. I'm sure I'm not gonna go back to WGNRR because I know everyone knows who we are. So I'm gonna keep moving. So I'll go back. I will go to the specific steps that we take as we commemorate or celebrate May 28th. Most of them have been mentioned earlier by Ms. Bing and the previous speaker. So I'm gonna go quickly and I'll share one of the campaign that we did with young people in Tanzania. So we are, as I said earlier, that we normally have this month before the May 28th. Like we start earlier April or the beginning of April to start the preparations, communicating with partner to see their area where they want, where they actually want to address the issues that they want to address. Then we develop a call for action. And after that, we develop material and toolkit, like toolkits, video stories that we collect from the partners and they share with us regarding the challenges, success, learnings, so that we prepare the material for May 28th and to be popped up during the campaign. Also, we develop tweets and Facebook messages to be disseminated to our targets. So after all this preparation, we disseminate the call for action and campaigning toolkit through different communications like website, as Danica and other previous speakers said. You can find the call for action, campaign toolkit, and all materials through our website. But again, we communicate in our other communication channels. We have a database for the partners that we work with in Africa. So we disseminate all the materials to them in different platforms. So this is a continuous sharing, like we will pop up to them or communicate with them weekly to make sure that they circulate the material through other networks that they work with, so that we cover a lot of people during our campaign. But also we will develop the monitoring tool. We will call to partners, like Danica said, this is the action to be done tomorrow or later today, to collect their plans their plans on what activities they'll be hosting during the May 28th day. Those could be the physical activities, online activities, so that we collect their plans so that we can support them in terms of capacity, in terms of circulating, circulating their campaigns, or supporting them financially with small finance to achieve the activities. But again, we develop monitoring tool. This help us to monitor our actions, to monitor how the campaign went and what has been achieved during our campaign. So in the previous times, last year we were having this a project around young people. It was a youth Saraichara academy, empowering young people to take up advocacy on the issues that are affecting them. So basically, young people were supported, were trained prior May 28, and they were supported with small funding to correct the challenges that they face in their communities regarding to access to Saraichara. So we had 3 areas. Mainly, they were collecting challenges around accessing information and service around menstruation, again around contraception and family planning, and accessing information and service on abortion. So young people were able to collect the challenges that they face from different regions in Tanzania, and submitted the challenges to W Generara, where the team selected top 10 stories that were compiled into a comic book, and we used that as a toolkit, as a tool for advocacy. So young people, after the comparison of the comic book, young people, we stipulated it to young people to be used in their communities, to hold their leaders accountable, to raise awareness, but again to demand for the issues that are challenging their communities, demand for services and information around contraception and family planning, to demand services. Some of them took up into abortion. Tanzania, abortion is not allowed. So young people started the conversation in the lower level to start like challenging the attitude and stigma around abortion. But again, some of the young people has driven the campaign around menstruation, menstrual hygiene management. So they did campaigns in their localities, in school, out of school, to demand safe environment for girls in menstruation. So that's how we have been doing in WGNR Africa. Thank you. Over to you, Mageda.
Thanks so much for your presentation, Matilda and Danica. Great tips there, definitely, on some of the ways in which young people have been able to run the campaigns despite the pandemic that was there and is still there. Just to highlight some of the challenges Danica was talking about in terms of, you know, not knowing how young people are doing, but really trying to connect and link up with them. And yeah, we'd really like to take this opportunity to invite you to just share with us in the chat box. How are you doing? You know, what campaigns are you working on? How are you planning to, you know, adopt the May 28th campaign? If you're planning to do anything, what have you picked up from you know, what Danica and what Matilda have shared in terms of, you know, ideas? Definitely, because it's a challenging time, especially wanting to do, you know, community activities and wanting to speak out in terms of the lack of essential services and access, especially for young people to, for example, as Matilda talked about, lack of, you know, sanitary towels, sanitary wear, also spaces to use to be able to clean up as part of the May 28th campaign. Also lack of access to safe and legal abortion. Also, also in terms of having spaces whereby young people can be able to communicate and just really speak out about their challenges. Also some innovative ways in which I think Danica spoke of is having some of those competition. And I don't know, maybe with a show of hands in the chat box, who would be interested in, you know, such type of activities, especially being young people. When I head over to the chat box, we got one recommendation from Pushpa Josie to everyone, saying that we can follow each other's social media and tag each other and share our campaign context to make collective voices during the campaign. Here are the social media handles for Yoshan. So Yoshan has shared, from Nepal, have shared their social media handles, and we would really like for other organizations, other individuals to also share their handles in the chat box, and also maybe be able to share with us some innovative ways that you think that we would be able to, you know, have the campaign as young people. And then from Tenzin Georgie, is humbly requesting to get presenter slides and if the presenters can share. So we hope that this opportunity would give us like some time now to have a bit of discussion. What campaigns have you been able to run as young people? How have you been able to run them? I liked also Matilda's sharing on developing of a comic book and having the comic book have, you know, the call to actions, the requests, and being able to share this comic book, which they did last year with YAS, and which is surely a good way, a creative way to engage young people. So maybe we can hear from some of the attendees as to maybe some of the things you're doing at country level or at local level, even at your community level. But also you can chime in terms of, you know, some of the challenges you're facing, particularly as young people, with regards to, especially in reference to the May 28th campaign on ensuring that SRHR is essential, and how this impacted on you. Anyone, just feel free to raise your hand. But also, yeah, surely all the 51 of us, at least one or two, have something to say, something to share with us. As we said, we'd like to have this space to be a bit more conversational, and have it be fun, the best way we can. So any responses to the presentations, any questions, and this is the opportunity, really. Or should I call out names?
Hi.
Okay.
Hello, Magda.
Yes, welcome.
Since
Hi.
since no questions are being raised, I think I just wanted to also add in terms of because we really need to know the context of young people. And this year, we also had a consultation with the local with the Filipino youth for our May 28th activities. And just wanted to share that a lot of the young people expressed that there really is a big impact in terms of their mental health. And this is also a result of a lot of SRH or sexual and reproductive health problems that they are facing during the pandemic. So, and I think last year it was only later on that we realized that we really need to conduct more care sessions for young people during this pandemic, and that's what we also are planning to do for this campaign. And I think in I'm also going to recommend to the other youth organizations that a lot of us have mental health challenges that are facing right now, and it's really important that we also take care of ourselves. And if we can also conduct care sessions or something like that to also discuss how we're coping through the pandemic, I think that would also be something that we can do in our organization or in our community. So there's also I think Frank Deus. I'm not sure if
Mm,
I'm pronouncing correctly.
yeah. Frank, you can go ahead and unmute yourself and share with us. And I also see some comments in the chat box, but go ahead, Frank.
Okay, hello everybody. Hi.
Hi.
Hi, Frank.
Okay, my name is Frank. I'm a former academy member from Tanzania, and now I'm going to share the plan on the menstrual hygiene day on Friday. So, our is located in Mwanza, Tanzania. We are currently running the online campaign about the menstrual hygiene day. So when you take a look to our Instagram account by the name Wadada Solutions TZ, we are currently running the online campaign that aims at raising awareness on menstruation, especially by encouraging men engagement so that we can break the shame on the menstruation period. So, and on Friday, we have planned to have like a documental. Since we are from the S Academy, we learned the advocacy in which we advocated for the building of the house that can be used by the girls at Mnaran Secondary School just to change their pads when they're at school. So currently, we have heard that the house of the building has been completed. So on Friday, we are going to have like a documental just to document what were the challenges, the progresses, and the success towards the advocacy that we have made by Matrida and Wadada Solutions on Gender-Based Violence at the YAS. So on Friday, we are going to have such activities, and currently we are running the social media campaign on menstruation hygiene. Thank you.
Thank you so much for sharing with us, Frank. What you plan to do as Wadada Solutions this Friday sounds very exciting and very interesting. And we look forward to joining in. Please do share with us so that we can be able to highlight and also share with other partners about your Friday activity. But I think that's a great initiative, definitely for young people in terms of talking about access to menstrual health hygiene facilities and services, and also safe spaces whereby girls can be able to change, and also bringing in male involvement so that to reduce the stigma. Thank you so much for sharing that with us. And I think if anyone also has interest in joining on from Tanzania or Kenya, I think I'm sure Frank and the team at Wadada would be gladly host you as well. Just to the chat box, maybe I can direct this question to Danica. Does W General, this is from Pushpa Joshi from Nepal, Yoshan, saying that does W General and May 20th campaign also recognize the health of transgender women within the framework of women's health?
Hello, hi. Yeah, that's a very good question. Also recognize the health of transgender women within the framework of women's health. Uh, yeah, so the answer, I'd like to also ask from our executive director also, if Miss Bing, if you can share more. I'm not really confident in answering this question. But in WGNRR, the framework that we're using is women and girls in all our diversity. And in the call for action, also in the call for action, she said that it's also mentioned. So you can also get more details about the framework that we're using in terms of the framework of women's health uh, in the WGNRR website, and also May28.org, because the call for action is in the May 28 website. But if she or Miss Bing can also add to that.
Thank you, thank you. Yes, Pushpa, Danica is about right when she said that the framework that we are using is that we always insist on talking about the diversities of the realities of women and girls, and that diversity includes transgender women and SOG, and also, you know, the different contexts where women and girls are in. So totally right. Within this context of women's health, the issue of transgender women are also very much, you know, included. As you've noticed within the call for action, we also talk about a lot around discrimination and inequalities, where a lot of LGBTQI persons have been, you know, subjected to. So yes, that's the short answer to your question.
Great. Thank you for that response, Ms. Bing and Danica. So the campaign definitely includes women and girls in all their diversity. Just going back to the chat box as well, from Sandra Sengenge, I hope I'm saying it correctly. Hi, Danica has really mentioned something important, that since COVID came, we started finding ways activities can be implemented differently, and that includes online. In Youth Changes Kenya, we have leveraged our information sharing on social media platform, as well as involvement of young people through Twitter chats on all important days that involves women's health, and calling out key people and organizations, including our leaders and decision makers. And it's proven to be very effective. And the network as well. The network as well as the work we do has grown. So yeah, thank you so much for that comment, Sandra. And also Sandra has put in their handles and you can get all their work on Twitter, Facebook, Instagram, and their new YouTube channel. Congratulations, as YCK or Youth Changes Kenya. Thank you so much for sharing that for us with us, Sandra. Yes, in as much as it can be challenging moving to social media platforms, Sandra has definitely alluded to the fact that they've been able to call out key people in organizations and decision makers, and this has proven very effective. And so also to encourage other youth advocates who are here with us that over also with tomorrow, you can get more tips on how to be able to run social media campaigns in such a way that it can be more effective. And then just thanking Pushpa for reminding us on inclusivity. Thank you so much for that reminder, Pushpa. And then we have from Henry Michelle to everyone. We are from Youth Advocacy Network Sri Lanka, and their handles are also in the comment box. Also, you can just kindly go on there and be able to follow and be able also be able to support and help each other in terms of really amplifying messages around May 28th and also around other campaigns. And then also from Lirisha Tulada, sorry if I'm saying it wrong, also putting in the Instagram, Facebook, and YouTube handles for Unfolding SRHR. And then feel free to also follow up and check out our May 28th call for action, and it's on our website. And we can be able to continue to amplify some of the messages, and it also has, we also do have some messages already put on there in our call to action that you can be able to easily copy and paste in terms of into your Twitter or Facebook accounts. So I think that would be great in terms of really amplifying the campaign. So at this point, I would like to ask Danica and Matilda if you have any closing remarks, because I know we shall continue with this session tomorrow as well. But for today's session, might you have any parting shot for our attendees? Matilda?
Hello. Is Matilda going to share first? I'll just go ahead. Hello?
Sure,
Okay.
yeah, go ahead.
Yeah, so actually this is just sort of a reminder, because of course this is not the end. We will still have a session for tomorrow on the social media campaign workshop, and what we really shared earlier is what we did last year, but hoping that after this 2-day session, it will also give you ideas to improve on what we did from last year, or to also create your own campaign activities in your organization or in your community. So if and of course, as promised, we also this session is an invite only. So we had organizations from Asia and from Asia and Africa who were invited to join us for the 2-day session. And we also mentioned that we will be providing campaign support. And to also inform you about that, we will email more details and also discuss the next steps in terms of receiving this campaign support. But we're happy that a lot of you have expressed an intention to really do an activity for May 20th International Day of Action for Women's Health. And as Ms. Bing mentioned earlier, the May 28th activities can be beyond May 28th. It's just a date, but of course, as advocates, we're doing our work towards women and girls and young people's sexual and reproductive health and rights. So yeah, for the next steps, we will discuss tomorrow, and also we will provide more details. That's from my end. So I think Matilda, do you still want to share more?
I think Matilda got disconnected.
Oh, okay. So I
Okay.
yes, Magada, sorry.
Though it's okay. I was just looking to say that also. Thank you for that, Danica. Just to say also from Yas, Joe, to everyone, we also campaign for women in the struggle for freedom all over the world. Say stay steadfast all. So that's a clarion call from Joe to everyone. Also just for actioning from Shifra, has shared our social media handles. So please follow us. What are you doing if you haven't followed us yet? Please do follow us so that you get more updated in terms of the campaign. And then just a word of encouragement, Louder Joe from Bing. Then finally, thank you to all the advocators and the lecturers for sharing their actions they did in the past and hoping for more valuable lessons tomorrow from Tenzin Dorji. Also, just to say that tomorrow the session will start at the same time, East African time, which is 1 p.m. Manila time, which is 5. Is it 5?
No, it's 6 p.m. in the Philippines.
Yes. Philippines time, 6 p.m. East African time, which is 5. And get the next steps on how campaigns will be supported. So we really look forward to hosting you guys tomorrow. Again, as we gear up to really have a robust campaign around May 28th. I think that's it from me. I will hand over to Danica, who will help us in terms of closing up.
Yeah. I think we're done. So we will for the Zoom link for tomorrow. We will just email it to your the email addresses that you registered via Zoom. And yeah, before we end, can we just request for a group photo? So right now, we earlier we reached around 54 participants. Right now we are 49. So um, in my Zoom, I'm seeing 2 pages of participants. So just post, and then I'll take the photo. One. Okay, so yeah, I'll wait for you to show your beautiful faces. Okay, one, two, three. Okay, on the second part, okay, one, two, three. Okay, so for tomorrow, it's our social media campaign workshop. We will have a facilitator for that. So hopefully, that will help you in doing your campaign activities, social media campaign activities in your community or country. Thank you so much. Bye bye.
Thank you. Bye.
Thank you, everyone. agora foi a fila, esse igual.